Welcome back. In news for your health, new recommendations for breast cancer screenings are out today, reinforcing that early detection can reduce the risk of dying from the disease.
Sydney Charles breaks down when women should get a mammogram and what cancer experts have to say about it.
New recommendations published in the medical journal JAMA lower the recommended age for regular breast cancer screenings, calling for those at average risk and who were assigned female at birth to get a mammogram every other year, starting at 40 years old instead of 50, and recommend this through age 74.
Preventive Services Task Force hasn't recommended that women in their 40s get regular mammograms since 2002. And so I think this is a very positive change.
That task force is an independent volunteer panel of medical experts. Their recommendations influence insurance coverage and doctors who schedule screenings for patients. The new guidelines are more consistent with the ones set out by the American Cancer Society. But the organization says the new guidelines should also include women over the age of 74, especially those expecting to live for another 10 or more years.
In our judgment, it is a shame if women get the message that mammography has uncertain benefits or is no longer needed at a time when the incidence is very high and the death rate continues to climb.
The American Cancer Society guidelines also differ on how often a person should be screened, suggesting women of average risk who are between the ages of 40 and 44 have the option to get a mammogram every year, and those 45 to 54 should start annual screenings. The organization advises women 55 and older to get a mammogram every other year or opt for yearly screenings.
Women should do their very, very best to be screened regularly at whatever interval they choose, whether it's 12 months or 24 months.
The updated recommendations do not apply to people with a personal history of breast cancer, a genetic marker or syndrome that may put them at a high risk of breast cancer, such as the BRCA1 or BRCA2 genes, or those with a history of high-dose radiation therapy to the chest, or a history of high-risk breast lesions. Sydney Charles, 4 News Now.